Hi, my name is Shane Janik. I'm the Executive Director at the ARC of Philadelphia, where we advocate for people with intellectual and developmental disabilities, or IDD. We run a healthcare advocacy program, HealthMeet, that brings disability education and experiential learning opportunities, working directly with people with IDD, to students who are our future healthcare professionals. The population with IDD experiences significant health disparities and inequities across a variety of specialties of care, including oral health care. Some examples include having 2 to 3 times the risk of having a tooth extracted before the age of 30, and utilizing general anesthesia for routine procedures such as cleanings and fillings. Our program specifically targets the social and attitudinal barriers to care with the intent to mitigate disability bias in clinical spaces. Now, let's hear from some of our partners.
I've been working in the field of developmental medicine for 25 years. And one thing that I've known in my field is the extreme importance of health advocacy to help support people with intellectual and developmental disabilities. Huge. It's such an important facet of how to best interact, organize, care, and support the developmental population as well as the caregivers themselves. We're very much involved in student education and training and getting students involved during the whole process of being aware of this is hugely important. We in the ADMD have been advocating for this, working towards a training and doing a lot of education. And Shane Janik, Executive Director of the ARC of Philadelphia, magnificent in all the work that he's been doing in the field. And I have support him and will continue to support him in all the wonderful work that he does.
I've had the opportunity to work with the ARC of Philadelphia over the last couple of years. Our chapter of AADMD, our student chapter, has reached out to them, and they've really given us a great perspective on how to treat patients with IDD. So in particular, we've been lucky to hear from multiple self-advocates that they were able to arrange for our club to hear, and that really gives us a great perspective on hearing directly from the patients on kind of what their own experiences with healthcare have been, and things that have really been good for them, and things where they'd like to see improvement in healthcare. So directly hearing from self-advocates has really been one of the best experiences I've had with the ARC of Philadelphia, and has really kind of changed the way I view patient care and things that I'm really strive to make sure I do to give the best care possible. So that's been a great experience.
We care for patients aging out of pediatrics with complex childhood onset conditions. We know that oral health is one of the major challenges our patients have, and we're so grateful for the advocacy of the ARC and all their interactive programming that teaches young health professionals about health disparities our patients face, and also the approach to how to make life better for them.
I'm here to talk to you about my dental experiences at the dentist. Overall, my dental experience has gone extremely well. What I like about the dentist is they pay attention to me and not my caregivers or my mom and dad. So please remember to talk to the patient instead of the caregiver or the mom or dad. Thank you very much for your time.
Now that you heard from some of our partners, we believe we're a great fit for the Diversity Innovation Fund, as disability crosses all demographics and characteristics of identity, and we firmly believe there is no diversity without disability. Thank you.